everyone, and a very warm welcome to today's awareness session on understanding breast cancer awareness, screening, diagnosis, and treatment. Breast cancer remains one of the most commonly diagnosed cancer among women today. And across India, we are witnessing an increasing need for awareness, early screening, and holistic patient care. While the number of cases is rising, advancement in diagnostics, precision oncology, and survivorship support are improving outcomes and bringing new hope to patients and lives. So today's discussion aims to simplify complex medical concept, address common misconceptions and empower individuals with knowledge. From awareness and early detection to treatment pathways and life beyond cancer. We are privileged to join this session brought to you by Voice of Healthcare. So it's my pleasure to welcome and introduce our esteemed panel of experts. Dr. Pooja Babbar, Unit Head and Consultant Medical Oncology, Fortis Hospital, Manesar, Delhi. She'll be joining us shortly. Dr. Devanshee Aakash Shah, Associate Consultant Medical Oncology, Poaris Hospital, Gurgaon, Delhi. Welcome to the session. Dr. Jyoti Bajpai, founder and president of Immuno-Oncology Society of India, lead consultant medical and precision oncology, Apollo Hospitals, Mumbai. Welcome to the session, Dr. Jyoti. Dr. Ela, consultant medical oncology, C Square Cancer Center, Pondicherry. Welcome to the session, Dr. Ela. Dr. Neeti Lekha Chabda, founder and president, Life Yes to Life NGO Gurgaon. Welcome to the session, Dr. Neeti. Thank you all for joining us today and contributing with your expertise to this important conversation. So let's begin our conversation by understanding awareness, screening, and early diagnosis. So, for this, my first question is to you, Dr. Devanshi, that in your clinical practice, what are the biggest barriers that prevent women from coming forward for screening or early diagnosis, especially in tier 2 and tier 3 cities? How can we address these gaps effectively?
Common barriers are myths prevailing. Are we continuing in Hindi or English? Sorry.
Either way, you can switch between the languages, but yeah, we would prefer going ahead with English.
Okay. Major barriers which we face is lack of knowledge and myths prevailing in the rural areas, in tier 2, tier 3 areas. There are many myths, like there is one common myth going on that in premenopausal patients, the lumps in breast are always benign, like they go and come with menses, but they are not malignant. So, generally, they are ignored. There is lack of knowledge that in premenopausal patients also the cancer can occur and lumps can be malignant. Another common myths prevailing are that if the cancer is diagnosed, then the breast will be removed. They don't know that we have a breast conservation surgery in which breast is preserved, only lump is removed. They don't have that knowledge, so they are afraid that their entire breast will be removed and they don't come forward for checkups. So many such myths are there. um, Another common myths are that once cancer is there, they don't know that currently early stage cure rates are very high, more than 70%, 80% patients are cured. They think that now once cancer is diagnosed, the end is near and nothing can be done. And also there is neglect towards ladies in rural areas. They are not given much importance. Ladies also generally try to put themselves behind the family, like they give more importance to children's, elderlies, and they neglect their own health. So these are, I think, the major barriers.
So yes,
You
thank you so much for bringing it across to us. And I believe in the later half of our session, we'll be able to address few of these gaps and bring. I mean, the experts can share their opinion and how can we bridge these gaps. So my next conversation is to you, Dr. Jyoti, that there is often confusion around mammograms, self breast exams, and clinical exams. So, could you clarify what the ideal screening protocol should look like for different age groups?
So thank you very much, Dr. Vaishnavi. I believe this is very, very important question. And I would want to say that screening should be, people should come forward to do their screening. The methods can be different depending upon the infrastructure, depending upon the, facilities available, and also the institutional and country's norm. But one should come forward for screening because it can save lives. So I believe that in 20s one should start doing self breast examination. And self breast examination means that on a regular time, after the monthly menstrual period, one should try to check both the breast, check for symmetry, check for any abnormality, and compare from both the sides. Again, it is not an obsession. You should be aware about your breast health, but it should not be really panic, and you should not be examining daily. It should be a fixed period, and you should be doing that. Then annual breast examination is generally recommended. In early ages, we say every 1 to 3 year clinical examination by an expert is also fine. Later, after 40, we say that it is advisable to do once in a year by an expert examination, so that we can really find if there is some abnormalities. Then screening is having lots of ifs, ands, and buts. And some countries it is regular mass screening which is recommended. In India, for various reasons, it is not the mass screening mammographic based which is recommended, but we are doing many times opportunistic screening, mammographic based. But breast self examination, clinical breast examination is very much applicable in all low middle income countries, also including in India, and very cost effective measure. We should be doing in highly, we should be strategizing screening based on their risk model, not only age alone, I would say, and the patients, families, not patient, I mean these are the normal people. So the with high risk of developing cancer, there we should be doing stringently screening, for example by digital mammo and MRI alternate, for if there is any genetic association, if they are BRCA mutation positive or some other, and if they are yeah, Gale model or other risk models suggest that they are at higher risk, then we should screen them more often. We should start also screening them early. Generally, the first person in their family, at what age they develop, before that we generally start, or we start even at early, like 30, 35, also in these women. So it is not one size fit all model. It has to be strategized based on their risk stratification, but all these methods are having their merits.
Correct. So I would just like to ask a follow-up question since you mentioned about one size not fit for all model. So we are seeing an advancement in diagnostics, including biomarker testing and imaging technology. So how has early detection improved treatment personalization in breast cancer?
So again, I think extremely relevant question, because if we diagnose, so I say that cancer is a continuum of care. It is not a one event, and one should perceive it as like pre-screening, screening, early detection, diagnosis, treatment, and survivorship. It is continuum of care. So if we detect a woman early, then we can avoid agony of being very sick, of agony of getting into metastasis, and requirement of very complex kind of treatment. So if we detect them early, then maybe we will be able to treat those women with single modality of care also. So again, when I say early, it doesn't only mean a size criteria. When I say early, it is biology specific also. So whenever we find, we have to screen them, we have to make them aware. And when we detect a small lump, for example, and we are finding that mammographic screening is suggestive of a highly suspicious lesion, we biopsy it up front, and then with biopsy we do a biomarkers, which you are saying. And breast cancer again is no longer one type. There are several subtypes based on the biomarkers. So if they are hormone receptor positive versus they are HER2 positive versus they are triple negative. We treat them entirely differently. So biology prevails, biology predominates, and we can offer them very good treatment based on this precision oncology based personalized care, in spite of being, detected early or even late.
Correct. So my next question is to you, Dr. Ila, that many women ignore early symptoms or misinterpret them. So, what are the early warning signs of breast cancer that should never be overlooked, and when should someone seek immediate medical attention?
Yeah, that's a very relevant question in our setup, Dr. Vaishnavi. So basically, just to tell the burden of this question, it's like when compared to Western population, in our Indian setup, uh, we see a lot of advanced disease. We Most of our presentations are either in stage 2 and 3, unlike mammo detected or screen detected cancers in the Western society. Despite women finding some abnormality in the breast, it takes a lot of time to cross the inhibition and reach the doctor in time to find out whether what is the abnormality. So, unlike other diseases, breast cancer lumps are a painless swelling. So, the early warning signs where like a person should reach a professional help is when they find a painless progressive increase of lump in the breast, or they see any skin changes or any abnormal symmetry which was not there previously before, or any changes in the nipple or areolar changes, or any reddish or colored secretions from the nipple. These are swelling in the axillary region or in the neck region. This is where a person should reach a doctor to find out more about them. To use the word like early warning signs, when do we detect an early warning signs? We should know what is our normal. Like ma'am had expressed, like we should be aware of what is my normal. So women should get involved. It should be a routine practice for them to do a self breast examination and know how do their breast feel in a normal way. So especially most of a persons when they find this abnormal lump, that's the first time they examine their breast. They would not even be aware of since when did they have it. So breast examination, self breast examination should be part of a routine, monthly ones or monthly ones, to know what is my normal thing. And most of the breast cancers occurs in reproductive age group, say from 20 to 45 years. So this is the period where we see other benign lesions like fibroadenoma. There is a high likely chances, if we do not routinely examine, we might miss out a breast cancer for in fibroadenoma. So any painless lump which is progressively increasing or changing in consistency should be brought to a expert doctor for further examination.
Correct. So, thank you so much for bringing it across. My next question is to you, Dr. Neeti, that as someone who is personally working in this space and you understand that how these patients are placed. So, what are the early signs or turning points that you have seen in your journey that you wish more women's were aware of, and how important is self-awareness in early detection?
Hi. So, early warning signs have already been shared. So, let me share a little through my own experience. So, I'm a breast cancer survivor, and I got diagnosed in 2012. I was 31 years old. I had never ever heard of self breast examination. I had no knowledge whatsoever. Nobody had ever told me that there is something like this that exists. Uh, so I was far, far away from any kind of awareness related to breast cancer. But God's been very kind. The lump was on the surface of the breast, and that is how, through a chance encounter, I felt the lump. And I thought that it's related to menses, and I slept over it for 2 months, because a lot of changes happened during periods. I wasn't in denial, I wasn't fearful. I was just so sure that it is what it is, and I forgot about it. Of course, 2 months later, it was still there, and that is how the whole journey began. two things that are very important to understand when we're talking about early diagnosis. One, like what Dr. Ela said, that a lot of times these cancerous lumps are painless. Because, in the work that we do, we hear so many women who come tell us that there was no pain, so they thought that there was nothing to worry. Because usually, where there is pain, there is worry. So we have to really remember that these are mostly painless. And two, I did not have any high risk factor. There was no family history. I got married at the right age, had my son at the right time, my breastfeeding. So whatever high risk factors mostly that we talk about, I had none of them. So to people who don't fall under any high risk factor, who don't have a known family history, breast cancer can still happen to anyone. So we have to remember that. And I was able to be cured because despite, of course, that I wasn't aware, thankfully the diagnosis happened at a very early stage. So I can't harp enough about the importance of self-breast exam and awareness, timely screenings. And even through our NGO, the vision that we share for awareness for downstage breast cancer. So, in addition to working towards providing financial support to patients for screenings, for their treatment, rehabilitation support, distributing free prostheses, bras, etc., we actually go door to door for breast cancer awareness in villages and slums. We do community clinical breast checkups. We provide free OPD to these women only to help them become more aware about signs and symptoms of breast cancer, to know their body better. And I'm happy to share that we have received ladies who come to our center in OPD, with symptoms of breast cancer, mostly lumps, only by doing self breast exams. So it is a must for people to be aware. And I have seen in my own experience that knowing and of course, I think all of us will agree that it is extremely, extremely important to know how your body feels and how does it feel when it changes. So that's very important.
It is a beautiful story to hear about your survivorship, and we'll be talking more about it in the second half of our discussion. And But there's one aspect which is left. I was supposed to take this question with Dr. Pooja, but I would love to hear from you, Dr. Ela, that breast cancer cases are rising in India, as I even quoted during the starting of my session. So, what are the most common critical risk factor women must understand today, that and how can early screening truly change these outcomes? So, I would love to hear from you that what are these critical risks that are leading to these rise in numbers? You are on mute. If you can just unmute.
Yeah. So to have the shortest answer, being a female is a risk. So anyone who has a breast, yeah, that is true. So anyone who has a breast even has a risk of breast cancer. Breast cancers occur even in a male, but it's more common in female. And the most common risk factor being the age. And the textbook risk factors, like Dr. Niti has already uh, said, uh, wherever we have increased hormonal expression, say for example OCP exposure, late marriages, or where there is a strong family history of breast cancer. So these are some common textbook which increases our risk than the general population for cancer. As Dr. Jyoti ma'am also has, there are various risk models like Gale model, where there is a history of any lump or history of biopsies taken in your breast. That again increases your chances of being detected within breast cancer. But having said all this, what we see practically is anyone can have, like Niti ma'am has already told, like most of our cases might not have one or two risk factor where we can actually pinpoint them, that this is the reason which has increased the cancer. Majority of the population. Among breast, there are around 15 to 10% of patients who are actually having a very strong history of breast cancer. Having a breast cancer relative, or a primary relative, or someone blood related, increases our risk when compared to the general population, where we should be even more strict about our breast examination, mammogram screenings, and we'll have to go to expert even more early, rather than wait and watch whether this is benign or a malignant one. So, to put it in a nutshell, what risk factor should we keep in our mind in order to help me detect or as early as, like, I haven't, being in female, I need to be aware of my body, and having breast, a lump, any lump for that matter, I need to be following up. Any lump could be a risk factor, but that does not, it should not, like ma'am had already told, this should not be something which we should be panicking about, but something which we should be aware about. If there's a lump, we get it examined, and if it's a benign lesion, we'll have to just ensure that we follow it up, that lesion. Most of the fibroadenomas per se, they are not a risk factor for cancer, but the problem is any cancer which develops can be mistaken for in fibroadenoma and results in a late presentation. So it is important we are aware of breast and the lesions present in it.
So I think very well alluded. I just want to add very quickly in 30 seconds that essentially one should remember that anybody and everybody can have a disease. The risk factors only increases the risk. It doesn't mean that if you do not have a risk factor, it will never happen. They only increase the odds of getting sick or getting any kind of disease. That holds true for breast cancer as well. Now, for a lump, to get more concern is a lump which is persistent, which is generally painless 85% of the times, hard, irregular, and many times associated with underarm swellings like underarmpit, which is lymph node areas. These can be alarming feature for somebody to understand. Generally the benign swellings are more smooth, they are slippery, they are not fixed, they are not hard, and they come and go. If they are associated with menstrual cycle, they will not be persistent. So these 4 or 5 very easy signs to remember for somebody. And any kind of discharge, especially if it is blood mixed, one should be alarmed. So these are kind of some the feature, and that's why I said it is not hard and fast, but you should see for the symmetry. If anything is asymmetrical in both sides of the breast, that is worrisome. You need to come into notice, and then it may still be benign. Benign lumps are much more common than malignant, but still there is a chance, so you should rule it out.
Correct. And I believe that very well puts up the point that having no risk factor doesn't eliminate the chance of developing a condition, it just amplifies at times. So, having said that, we'll move to the next segment of our discussion, which is treatment, survivorship, and holistic care. So, for that, my first question is to you, Dr. Devanshi, that side effects of treatment often create fear among patients. So, how has modern oncology improved in managing side effects and improving the quality of life during the treatment?
So before side effect, I would like to consider one more thing for which patients are generally afraid and generally don't come forward for diagnosis and treatment is there is widespread belief between the group of people that biopsy spreads the cancer and biopsy causes the cancer to spread to different organs. It leads to rapid growth. So this is a very important myth that should be should patients should be made aware of, that biopsy does not spread the cancer. There are multiple trials have been done, literature data is available that it does not spread the cancer. One thing, uh, if I explain it in simple language, in any body part, if we have any trauma or a cut, then there is generally an inflammatory reaction which causes that area to swell up. So with biopsy is also kind of cut in a body. So with biopsy also this happens, and there is inflammatory reaction. The blood WBCs and inflammatory cells accumulate in that area. So then generally there is some enlargement in the tumor after biopsy. But if treatment is started immediately, it does not spread to other organs. So that is one important thing to be considered. Now coming to the treatment aspect. So Mainly chemo. I will divide it in chemo, surgery, and radiation. So, chemotherapy, many side effects are now preventable. Uh, we have very good anti-emetic drugs like NK1 receptor antagonist or 5-HT3 receptor antagonist. So, all this, we see almost zero chances of developing nausea and vomiting after chemotherapy. Patients can continue their work if they can continue all the job also, and their daily household activities like cooking and cleaning and everything can be continued. They does not generally feel very fatigued after chemotherapy. We have growth factor injections so that they don't develop any blood count suppression, blood count drop. They don't develop infections related to blood counts drop. We have now cooling caps available, which is the very important thing, because generally the women's are more concerned with the hair loss. So with cooling caps we can prevent 50% of the hair loss. And even there is the one thing that they should know is not everyone can afford cooling caps, but the hair loss is reversible once you complete the chemotherapy. It the entire growth comes back in around 6 to 8 months of time, and the hairs are as good as they were previously. So this is very important. And another thing is neuropathy, tingling, numbness in their hands. This is also now preventable with the help of cooling hand gloves. So many of the chemo related side effects are now preventable. Now with surgery we have options of breast conservation surgery. So with that we are able to conserve the normal breast, and the body which the what we call is that asymmetry which they feel with the mastectomy is generally way better when we do breast conservation surgery. Lymphedema post surgery is also preventable if good exercise is done, and there are a few other molecules. Physiotherapy is also very effective in dealing with lymphedema. So with radiation also there's some skin discoloration, but it generally goes away as the time goes on. So now with the advances in treatment, many of the side effects are preventable.
Correct, and I believe that we will have more such advancements. And the best message from here would be that we should look for treatment first and then look at these side effects, because side effects can be overcome with time. So my next question is to you, Dr. Jyoti, that precision oncology and genetic profiling are gaining attention. So how is personalized medicine transforming breast cancer treatment outcome in India?
So again, a very very important and meaningful question, Dr. Vaishnavi. So essentially, I would say that we have really came from one size fit all model to one size fit model doesn't holds true in this era. And previously, what sounds one disease like breast cancer, all breast cancer were given kind of similar kind of therapy based on histology. It is definitely progressed from there to given a biomarker driven care based on their IHC based DRPR HER2 and triple negative subtypes. And then from there, we are now in a personalized therapy or precision therapy era, wherein we are doing the genomic analysis. We are finding that what kind of other abnormalities, other mutations where which are prevalent, and how can we best target them. So definitely there is lots of progress, and I believe that one should be very cognizant and one should be very judicious when choosing these things, because nothing is panacea in this world. And similar time, people feel many times there is a myth that all the time precision oncology is a very expensive, very fancy treatment. I would like to say here that once upon a time what was fancy is a reality today, but it should be in expert hands, the people who really know it. I'm very sorry, but I'm seeing these days that a lot of time patients are walking in genomic analysis report in hand in early cases, etc., where it is not really having much relevance. So one should be knowing that the people who are prescribing should know why we are looking for that, whether this is going to change the treatment, how it is going to affect, and What is the authenticity of the lab wherein you are asking, you are ordering, because that is our responsibility towards our patients. So I would say that in expert hands, taking cognizance, this is extremely relevant and important. But other side is also true. Many times there is, useless investigations, too many things which are ordered, done, and nothing to act upon. So one should think that what is actionability, what is the difference in that particular patient's journey, what we are bringing it. But again, I would say in advanced cases, for example, in ERPR positive patients, again, in spite of having that hormone receptor positivity, it is no longer a single disease. There can be a PIK3 mutation, there can be an ESR1 mutation, which we need to pick. And these are the resistance mechanism. Why some people on hormone therapy developed an early resistance, why some develop late, or why some never develop, right? So we need to know that. So these are underlying pathways that when we delineate, we know. And there are now therapeutic relevance also, because we are having targetable mutations, we are having targeted therapy available, which make a difference. And also it makes sense to do serial liquid biopsies in these patients to test their ESR1 mutations, developing in due course, because with every recurrence there is data to suggest that they increase in second recurrence up to 40%, which is almost half. It's important to know because we have drugs to act. So personalized therapy is very important. Again, I would say it is not only doing a sequencing. Personalized therapy, when I say, it is essentially towards an individual, because we are treating a patient as a whole, not the tumor alone. And there is age matters. So a geriatric patient of breast cancer of mine who is more than 60, 65 is entirely different, differently treated, because they have multiple other comorbidities, diabetes, blood pressure, cardiac illnesses. They are on polypill therapy, they are in mobility restrictions, and limited social support. One needs to be cognizant about that. Similar time, I'm very passionate to treat young patients, adolescent and young, which is less than 40. They are having different challenges: pregnancy, fertility, body image. So we need to treat them differently. While I was in Tata Memorial for almost 2 decades, and I did lots of trials in this population, we found that body image issues are important, and we did the first randomized trial for scalp cooling by Paxman system, and we found that we can preserve their hairs in randomized fashion, and that gives them dignity. A lot of times these women are very aversive to chemotherapy because of hair loss. Then we did another randomized trial to find that a low dose olanzapine, which is a very small intervention, an antipsychotic drug which works very good as an anti-vomiting drug. And this is our own data, very low cost affair, and we found that not only we can substantially reduce nausea, vomiting, we can also reduce the daytime sleepiness. When we are using this low dose, this is now adopted in international guidelines. This has changed NCCN guidelines. So we need to really see what is relevant, what is important in our clinics, for our women, for our men also. As somebody rightly said, 1% of men also, they develop breast cancer. So one must be very particular and individualized in offering them care, because every factor is important. Even their cultural practices, their cultural beliefs, their professional commitment, their personal commitment, it is also important. And last but not the least, economics is also a science. One should be cognizant that while you're prescribing, whether they will be able to afford. There is no meaning that we have written something and after 2 cycles they will not be able to take it through the course. So when put together all this, I say this is personalized medicine, and I'm truly a proponent for this kind of care.
Correct. So thank you so much for helping us understand it so well, because I was about to ask a follow-up question that how do you plan these treatment when now we have, like, we know chemotherapy, we know targeted therapy, we are now being acclimatized with this term of precision oncology, but you helped us understand all of that. So taking the conversation forward, my next question is to you, Dr. Ela, that post treatment care is often overlooked. And so, what does comprehensive survivorship care look like, and how important it is for long term follow up?
Yeah. So as we advance in oncology and detect more and more early cancers, curable cancers, this survivorship becomes more and more important, because we'll see more women who survive cancer and lead a very normal life. So in order to address survivorship, we can categorize grossly into 4 5 categories. One, disease related management, where we regularly screen the survivors for the status of their cancer. Say, for example, yearly mammogram to look for any disease recurrence or any second malignancies for that matter. The second category would be treatment related. So, for a survivor, we would be looking, like most of the hormone positive patients would be on maintenance drugs, hormone based drugs. So, there we would be watching on their bone health in a regular interval. Apart from it, in selected cases, we'll also be watching their cardiac health in the form of regular echo examination. So these are some treatment related specific which we would be watching. The third part would be the physical well-being. Physical well-being. Most of the patients post surgery, they have this regular shoulder pain, the chest pain. They have some difficulty in mobilizing their that part, the surgery side, post surgery, post mastectomy, or wherever there is an axillary dissection. So it is very important to teach and educate the patient for those post operative or this perioperative exercises to have a near normal life. They might be cancer free, but if they have this shoulder pain routinely where they are not able to take their hand overhead, use their hand for their regular work, it becomes a pain throughout the life which they need not carry. So it is important they inculcate a new lifestyle where they take care of their post surgical side in the form of ensuring exercises for lymphedema prevention and routine joint exercises as prescribed by the doctor. So this is the physical aspect of it. The mental aspect of it, which then the fifth one is the social aspect of it. This is a very sensitive one, and it is where we as a public should help them. Most of the patients, after finishing their surgery, chemo, radiation, they we most of the patient would not show their happiness when they come in their initial practice, because it's a post trauma effect they would be carrying. What if I get the cancer next? So will I have a recurrence? So for them to come out of this treatment and hospitals investigations, it takes some time. So the more they get used to their routine, they get it easier to come out of this, mentally cured. They are physically cured quite early, but it takes some time for them to mentally come out of, this journey of treatment. And the social aspect of it, as like ma'am told, body image issues like post mastectomy, moving back to the society, the same confidence. So there are many new modalities, which is better modalities which was not accessible before. Like Niti ma'am told, in my part of town Pondicherry, it's tier 2 city, where like for me to access for prosthesis, for my to make available for my prosthesis, I'll have to take an extra effort for them to reach that, to get a proper wig for them if they want a wig. These are some things which is not yet easily available everywhere, but then yeah, there is definitely a progress in these aspects. So these five aspects are very important in survivorship.
Correct. Yes, a note very well taken that do have advancement, but yes, it is a long way to go, and it will take some
Exactly,
time
yet to reach.
for these advancement to reach the tier 2 and tier 3 cities, which is is something that needs to be talked about and tapped in the next future. So my next question is to you, Dr. Neeti, that as a cancer conqueror, counselor, and inspirational speaker, what does survivorship truly mean beyond medical recovery, and how can families and caregiver better support someone critically?
Okay, so my Insta handle name is Beyond Breast Cancer. So I truly believe in living life beyond breast cancer. And honestly, if given a choice, if I would like to have a life where this experience would not have been there, I don't want that. I'm so happy and thankful for the life that I have been given, including this experience of cancer, because you understand the importance of life much more. you start to take care better of yourself, exercising and eating healthier, prioritizing. I started my NGO Yes to Life, which through which I have gotten a new purpose in life. Life has become more meaningful. The amount of satisfaction, happiness, and peace that it gives me, it is immense. I became more spiritual. It's easier to let go. So my husband's also happy. So a lot of happy things that have come our way through the journey of cancer. And it is not to say that it was an easy road. I mean, I underwent mastectomy, chemotherapy, hormonal treatment. It was a long journey. But I think what really matters is what you make of that experience. Like it's a choice of why me or wow me, and what you choose to make of it. Uh, One thing is that, like you talked about caregivers also. When I got diagnosed, like I have mentioned before, that there was no family history, but there was a huge amount of faith in me that I'll get all right. I didn't know that this, that how is staging done, and this is all before those staging tests and other things were done. But I told my family that I'm going to be fine, and we will never ever think of what if something happens to her. My son was 2 years old at that time. So there were a lot of opportunities to think about what if something happens to her. But as a family, then we took this decision that we will consider this only as a phase and not go on that thought of, train of thought that what if something happens. And and even that journey became much more simpler through this thought. To the people whose loved ones are going through cancer treatment, one, while I understand that you come from a place of love, immense love, but please try, if you can, just stop telling your loved one, your patient, that everything will be fine, because it's not so easy to hear this from somebody who's not been through that experience. And if you really want to help them out, make them meet people who have been through it, who can tell them that there will be a normal life post cancer, because this is what a patient undergoing treatment really wants to hear. And when somebody who's been through it and is now leading a normal life tells you that, the confidence is, next level. Second, this is something that I did personally when I was undergoing treatment. I told my family that I don't want to meet any relatives or any neighbors who will come and say, oh my God, what happened to you? How did this happen to you? Because many times people come to you maybe with concern, but the way that it comes out is not really good. And it is how the society is. So I had told everybody around me that I will only meet those people who, when they go back, would make me feel better and positive. So please don't care about what will people say. If you tell them not to meet your loved one, your patient, put it on the doctors, tell them that the doctor has said no, low immunity, she can't meet anyone. But this is a very, very important thing to do. And third, last, not the least, is that please take care of yourself. So for the caregivers also, because if you are in a happy and peaceful state, it is only then that you will be able to have your loved one also be in a happy and peaceful state. So do take care of yourself as well. Yeah.
So,
Correct.
I can't stop chipping in for 30 seconds what Neeti really mentioned. It's really, really close to my heart, I would say, because, I truly believe in being positive. And I really say this to my every patient that this is my personal and professional prescription, that you have to be positive. Whatever is the thing, right now there is a bad news which is already broken. You got this diagnosis, nobody would be wanting, honestly speaking. But in everybody's plate, there is a disease. So this is also one of those. Now it has come. How we will handle, make our choice is our choice, and that will decide a lot of things. So I say that, now we have to see the good part of it, that we are fortunate in an era where there is lots of medicines available, and glass is always either half empty or half filled. And I truly believe that glass is always half filled for me, it is never half empty. So I never ever give up, and that's what the commitment I ask with my patients and their families, that now we have to handle it as a project. I'm not saying any false hopes, any other things, but whatever it is, in this situation we will do the best. So when you have that belief, and fortunately I witnessed thousands of patients in Tata Memorial and All India Institute, and my journey in Sloan Kettering and Hopkins. And I really, I can tell you that it is not a randomized trial, but The patients on similar kind of situation, if they are positive attitude versus not, they behave differently, their outcomes are different, their toxicity patterns are different. So encourage, what she said, it's very, very important. And never ever get any negativity from anybody, because that will really bring you down. So try to be as positive as possible, try to do whatever best. That is in our hand, and collectively this is everybody's responsibility. Doctor, paramedical staff, NGOs, patient, family, put together, we can come with the best outcomes in that situation.
Correct. So, I mean, it has been one of the very inspirational sessions for me. So, before we conclude, I would like to ask each of our panelists one final question. So, what is that one message you would like to give every woman and every family watching us today to remember about breast cancer? So, I would start with Dr. Devanshi. You can go first.
So, I will tell only one thing, that there is life after breast cancer, and only prerequisite is early diagnosis. So, have a faith, get yourself checked frequently, and know your body.
Correct. So, Dr. Jyoti, if you can give one concluding remark for our audience that is watching us live.
Right. So I would say that, William Osler said that, it is not really important that what disease a person had, but it is important that who is that person. So I believe that truly with the advent of precision oncology, we are having a chance to get to know who's that person and treat it as a whole. Please think whenever you are treating, and it is not to say, it is to feel what entire persona. And then if you really kind of in sync with that, you will be able to do the justice with the person, with the caregivers, and yourself, because ultimately that doctor patient relationship is very, very different. And I believe that that is very respectable. You have to justify that, and if you go with full intent, you will see best of the outcomes. At times miracles do happen, and I want to believe that that miracle will happen with the patient sitting in front of me, because again, whatever we talk, it is statistics. So that's where I say that even if there is a 90% chance that you're not going to make it, there is still 10% chance that you will be. And upfront, I cannot tell who will fall into 10%. So if you are going to take that risk with me, I'm with you.
So, yes, Dr. Ila, what would be your message?
My
You're on.
message, Jyoti, your messages was very inspiring. Hope many listen. Like you told, to hear from the doctors than someone who fought it out, it is even more, close to them and would be very relatable. Great going. So my one-liner would be to all the women there, both the survivors and the general population, put your mental health and physical health forward, and go ahead. That's all. Just be aware of your body and take your health forward. Many women, do not come as for early to in medical access when it is for them when compared to their family members. So put your health forward.
Correct. So, Dr. Neeti, what would be your concluding remark for our session today?
Uh, so I would just like to add to everything, to what everyone have already said, that don't let fear stop you from going to the doctor in the right time. I have been through the journey. It can pass, and I know that there are two body image related issues that a lot of us have, because of which we feel that we don't want to go to see the doctor. Yes, a hair fall happens, but these are my natural hair, so they do come back beautifully. And two, losing a breast to cancer. I did lose a breast to cancer at the age of 31. But there are ways and means to have your body image back. You can either keep an artificial breast, which is a prosthesis inside your bra, and other than you and your partner, nobody can know that you don't have a breast. And 3 years post that, I got breast reconstruction done, which is, of course, a personal choice. But whether you want to get that done, or you can or you can't have that done, prosthesis is always there. So, no, there should be no reason why you should not reach the doctor at the right time. That is all.
Correct. So, thank you to all our esteemed experts for sharing such valuable insight. And with this, I would like to say that breast cancer awareness is not just about medical discussion, it is about empowering individuals and knowledge, encouraging early screening, and building a strong system for patients and survivors. So, through our continued awareness and collaboration, we can make a meaningful difference. Thank you to everyone who joined us today. Stay aware, stay proactive, and take care of your health. So, thank you to each one of you.
Thank
Thank
you
you.
very much.
Thank you so much.